In many cases, information is spread out all over the health system.
I certainly expect my primary care physician to have access to all the pieces.
The evidence-based guidelines and recommendations are changing all the time.
A couple of years ago, I had surgery and I was inundated with paperwork.
The voices of doctors and patients. They were our inspiration for the Clover Assistant.
You go to your doctor, he's on a treadmill every 15 minutes, he's got to get another patient in.
It's very common for me to have patients with 3 or 4 active chronic conditions.
There wasn't continuity of care, and then you end up not getting the care that you were looking for in the first place.
And it was like, okay, now I just retired and you're going to do this to me?
The Clover Assistant is a web application, and a physician uses it every visit that they have with one of our members, and it's tuned to show them clinically useful, personalized, relevant information that helps them give better care during that visit. So what we can do is match every patient's individual data, because we've pulled it all together, with all of these clinical evidence-based protocols that are coming out all the time. And now for every PCP visit, every doctor visit, that PCP is seeing exactly the information they need to, and technology is powering all of that.
I was taking a pain medication that reacted badly, and I ended up in the hospital.
I go and see my physician, say, oh, gee, why are you here? I said, aren't you aware I was in the emergency room?
If the data that I have about a patient is not up to date, then I could be making a medical error.
The way that our technology helps specifically is to personalize the care for every single member. So we're not just saying across the board, treat everyone the same. Everyone is different, and technology is really good at bringing that difference to the surface and personalizing care.
The information is really set up for me in an efficient way within the program.
It means that I'm providing better care, and it also means that I have confidence that I'm really providing that better care, and patients feel that.
We see this as a way that we can make the whole system more efficient. It's a huge bureaucracy around doing paperwork and filing claims and checking insurance. So if we can take that inefficiency out of the system, power it with technology, help physicians give better care, we can take that and actually make healthcare more affordable and at the same time give better benefits and better outcomes.
Clover Assistant really creates a conversation between the doctor and the health plan through the technology. And I think doctors feel more respected when it's a conversation than when a health plan just says, you need to do this or that, because when health plans do that, they're often wrong.
A lot of times we get questions where they say, well, physicians don't use software. And we're like, no, they want to use software. We live in a technological world at this point. We've just been giving physicians bad software, unfortunately. We have a way of informing and educating and engaging with any PCP. We scale at the speed of software.
It is such a delight to have all the information I need right there in front of me, and then I feel great about the care that I'm providing my patients.
Clover Assistant is being used by physicians. They enjoy using it because it's built for them, and they know that when they use it, they are actually helping take care of a senior better than if they weren't using it.